The second conference of the Public Health Alliance for Genomic Epidemiology, or PHA4GE, returned to Cape Town in 2025, following the first meeting in 2023. Here, nearly 300 delegates from across the globe gathered to share ideas, discoveries, and solutions. For its second conference, PHA4GE partnered with the International Pathogen Surveillance Network Global Partners Forum, hosting its second gathering as well. The IPSN Global Partners Forum is a global network of pathogen genomic actors brought together by the World Health Organization Hub for Pandemic and Epidemic Intelligence. PHA4GE and IPSN share a common vision, as expressed in the theme for the 2025 conference: Data for Action, Overcoming Challenges and Seizing Opportunities in Public Health Genomics. As befits these many partnerships, collaboration was a recurring theme at the conference. Particular reference was especially made to the partnership between PHA4GE and the IPSN and the role that these and other organizations can play in informing and shaping public health, particularly as pathogen genomics grows in prominence and importance.
Having been WR for 7 months here in South Africa, I would like to see how we strengthen the linkages between these networks, the alliances, and the member states. So in other words, using the data, translating it, and using it for public health decision-making.
One indicator of how important this is that pathogen genomics is right at the heart of this discussion about the pandemic agreement among member states, whether we like it or not. And that maybe is just a flag to everybody that this topic is, yes, a scientific topic, it's a public health topic, but it actually transcends that.
While pathogen genomics is being increasingly recognized, it is not without its challenges. This includes having tangible impacts on the tracking and monitoring of disease outbreaks.
And thinking around the knowledge generation, and I think for me over the last 5 years, as being part of the PHA4GE consortium, has been to realize that there is a clear distinction between data and knowledge. I think our technological advancements globally and lower the barrier to entry for those has meant that the data production actually becomes a easier component of what we do collectively. But it is the knowledge production which I think is our challenge.
To our organizations, to the founders, to the different stakeholders that we need to work together and said, this is what we need to be doing in the next 3 years to make sure that we can get this genomic data into action, into insights, into public health intelligence.
Yeah, so the community of practice for cholera genomics, really the idea is to bring together local and regional experts who are based in this high burden area where cholera is problematic, who will then be, leading effort in integrating genomics to inform public health control, of course, complementing other intervention strategies that already exist.
So this is like the huge area. It's like a hugely challenging area now is to really solidify the data standards, to develop them in ways that are accessible to as many people as possible, that allows us to integrate that data to solve those big problems.
These are also 3 related projects. So the first of which is this landscape analysis and identifying the applications of the technology currently in the space and what we anticipate in the future. The other project that Rintu leads is understanding the data and resource gaps that are present throughout AI. A lot of this also leans on the biases of the current data sets and what that sort of might entail in the space. And then, of course, the third being this conversation about equitable access.
Yeah, just, what we were saying is that the 2 main areas as we are discussing, for you, whatever concerns or whatever answers that come about from the 2 areas will have an ethics element embedded into it.
The conference proved to be a showcase of knowledge production, discussions, posters, workshops, and presentations covered a host of subjects and themes, from data standards and new data repositories to the setting up of infrastructure and workforce development, as well as policymaking and funding, among many others. The There is one final step that PHA4GE is keen to see realized over the next 2 years, connecting the work that PHA4GE does with public health priorities.
And so when one is thinking of sustainability, our next conference will have to put the spotlight on national engagement in order to facilitate the longer term implementation of these tools.